It was a dream. I always thought in the back of my head when I was watching the 76 Olympics on TV, I was 11, and I said, wow, it'd be really great to be in the Olympics one day.
There is Tori Trees of the United States, 19 years old, from Louisville, Kentucky.
It was really special to make the team. My whole club team from Kentucky was there, and they were all cheering, and of course my Texas teammates too. I started noticing it was hard to get out of bed, and the more I'd walk, my blood pressure would be really high, and I'd be walking really slow and just really crooked. And my husband was real concerned, and he's like videotaping me, showing me how I'm walking, and like, straighten up, what's wrong with you? You know, didn't have any idea. So I went to the doctor, and we did all the testing, MRIs, and it showed that I had adult onset scoliosis.
Tori presented as obviously a very fit female for her age, and she was really disabled. And she was very pitched forward and to the side, so she had a lot of deformity.
He goes, I want to see you walk. And I'm like, it really hurts. Are you sure? And I'm walking. He goes, okay, we need to fix you.
She had pressure on her nerves, partly because of her spinal deformity, where her spine starts to curve, and then also because of disc, where the disc starts to squeeze out and pinch the nerve. But the main thing is her pain was so incapacitating she couldn't stand up straight. We specialize in deformity, and that's exactly what she had. She had a complex spine problem with scoliosis and spinal stenosis at the same time. And to try and fix both of those things, we really want to make sure that we don't cause more problems, that we fix what she has and go from there.
I am able to swim now and do everything that I did before my surgery. So it was the best decision of my life to get this done. And I think if I didn't do it, I wouldn't be able to walk. I'd be in a wheelchair.
Her particular case obviously needed surgery. She was going in a bad direction. And our goal was to try to save her the most segments, so stabilize her scoliosis and her deformity, take the pressure off her nerves, but leave her the most amount of flexibility in the rest of her spine.
I had L1 to L5 fusion with rods and spacers in between my discs, because my discs were bone on bone, and so the nerves were getting pinched, and so that's what I was feeling. That's why I couldn't move. And it doesn't bother me now. I don't think about it. So I'm really lucky that I don't have any pain, and I'm just real fortunate to be able to do everything that I did before my back started hurting, which is pretty crazy to think because it's in my L1 to L5, my lower back. And so, yeah, I can flip, turn, and swim and do all the strokes, except butterfly. I couldn't do butterfly even before my back hurt, but.
I think her prognosis is going to be great. I think she's a special lady. She's very active, and don't require her to see me in other than a kind of a well check.
Thank you, St. David's, for getting me back in the pool.